Kuntong, I have a stomachache.
I think you might have a stomachache from a spicy mango salad yesterday. Please take this medicine. It should to help to relieve your pain.
Oh, this is soda mint. It helps reduce stomach acid. Thank you.
Today, I have to go to work at my friend's dormitory. Maybe I come back tomorrow morning. Take care yourself.
Okay, thank you.
Hello, what's your name?
My name is Prakin. I'm 21 years old.
How tall are you and how much are your weight?
I'm 160 centimeter. My weight is 50 kilogram.
What are your symptoms?
Before coming to the hospital, there is pain in the right lower abdomen.
How long do you have these symptoms?
4 hours ago.
Before you come to the hospital, have you taken any medicine?
I taking one tablet of sodamint, but the pain didn't improve. Therefore, I decided to come to the hospital.
Will I measure the fever and vital sign?
Yes, please.
Okay. Your blood pressure is 142/86 millimeter of mercury. It's a little high. And your body temperature is 37.9 degrees Celsius. You have a little high body temperature. Wait a moment, please. The doctor will come and check your symptoms.
5 minutes later.
Hello, how are you feeling now? I have a stomachache at the lower leg area. I would like to check your stomach. Yes.
A few moments later.
From my examination, I think you have a left appendix. You must have urgent surgery by tonight. Oh my god, what should I do now? Don't worry about it. There will be a nurse to advise you before the surgery.
Hello. Do you know what to do before undergoing surgery?
No, I don't.
Okay, I will tell you now. 1. Do not put all kinds of jewelry and other orthotics, such as false eye, removable denture, contact lens. 2. You must insert urinary catheter before going into the operating room. 3. Sign the permit to consent to treatment by surgery. 4. Tell relative that the patient will receive treatment by surgery.
Okay, I will do it.
Do you know what to do after undergoing surgery?
No, I don't.
I will explain what to do after undergoing surgery. 1. Try getting out of bed after the first 24 hours of surgery for faster movement. 2. Reserve for the first tip. There will be movement of money for medicine to get a sip of water. If there's no blooding to receive soft food and regular food as scheduled. 3. Teach the patient for drip breathing and effective coach. 4. Do not scratch the wound or affect the wound because it can cause inflammation, swelling, and redness. 5. When caulking, use hand to hold the wound. It can prevent the wound from splitting and reduce the pain. 6. Keeping the body clean by wiping the body. Do not allow the wound to get wet. If the wound is wet, the wound should shake immediately. 7. Taking medication according to the doctor's treatment plan. 8. Eating useful food. 9. Get enough rest. Do you understand?
Yes, thank you for a suggestion.
You're welcome. I will transfer you to admit at the ward of female surgery now. There will be another nurse in the ward to give information and advise you again about pre-operative preparation and post-operative practice.
Okay.
Okay, let's go to the ward of female surgery.
Oh, how are you feeling now? Last night I'm sorry for not answering your phone. Just working, but the battery ran out too. I feel very guilty. Are you angry with me that last night I did not go to take care of you?
I'm not angry with you.
Why not?
We just friends. Why would I be angry? But if you are my girlfriend and leave me alone like this, I will definitely get mad at you.
But I want you to be angry with me.
Good morning.
Good morning. This morning your face looks so bright. Did something good happen?
Of course, my good thing is that I am asleep, but your face doesn't look good at all. Did anything happen last night?
No, nothing happened. I'm just sleepy.
Shall we begin the nursing report? You will finish the job quickly and go back to sleep.
That's a good idea. Bad one, Miss Jacqueline. She is 21 years old. 6 hours before she came to the hospital, she had a pain at right lower abdomen with fever. She taking one tablet of sodamine, but the pain didn't improve. 4 hours before she came to the hospital, she had a pain at right lower abdomen, so she decided to come to the hospital. The doctor diagnosed it as appendicitis and had an appendectomy last night. There is delayed suture in the lower right lower abdomen. After the operation, she received 2 antibiotics, ceftriaxone 1 gram when each 8 hours and metronidazole 500 mg each 8 hours. The patient had no fever and blood pressure is normal, 106/88 millimeters of mercury. The patient said that she had a severe wound pain. Her scar was 8. I injected the morphine 10 mg for reduce her pain. After that, the pain score was reduced to 2, and she was able to rest well last night. Please observe her pain score every 2 hours. The doctor plans to give the same antibiotic to continue. The wound is skid dry, covered gauze, and hyperfixed.
Does the patient have relatives to visit or take care?
No, please observe the patient condition regarding side effect of the drug, the allergy and pain. The patient face look fresh today, so there should be no problem.
I think so. Do you have any additional reports?
No more, my work is finished. Then I go home.
Okay, you hurry back home to rest.
Have a good day. Bye.
Thank you for your blessing. Good morning. What's your name?
Good morning, my name is Yoparin.
I'm a nurse. How are you feeling now?
Now I am feeling better than before, but I still didn't pain a wound.
If 0 score means no pain and 10 scores is the most pain, how much your pain score?
I think about 2 or 3 score.
You have a rupture appendectomy last night. 24 hours after surgery, you should do deep breathing exercise about 2 or 3 times per day for prevent lung atelectasis. Now, I will give advice and demonstrate to deep breathing exercise for you.
Okay, first, sit or lie flat in a comfortable position. Second, put one hand on your belly below your ribs and put the other hand on your chest. Third, take a deep breath slowly through your nose until your belly in bowl. Then, hold your breath for 2 to 3 seconds by counting the numbers 1 to 3 in your mind. Fourth, exhale your breath slowly through purse. Breathe until your belly in flatten. Can you try to do it? Follow me now.
Yes, I can.
Okay, you done it very well.
When will I be able to eat?
Now, you must also refrain from food and water first because now just after the first surgery, you must wait until there is movement of the intestine. Then the doctor will start to sip water. If there is no bloating, will start to give liquid food, soft food, and normal food respectively.
Can I wipe my body?
Keeping the body clean, you can wipe the body, but must not allow wet wound if the wound is wet. It can cause an infection. Should notify the authorities immediately, and you should get enough rest 7 to 9 hours per day in order to improve symptoms.
Nurse, I would like to ask one more thing. I was feeling sleepy and dizzy. Is this a side effect from the drug?
That's right. I explained the medication you receive and the side effect. First and foremost, you are given 2 antibiotics, ceftriaxone and metronidazole. Both drugs have side effects. The side effects of ceftriaxone are diarrhea, watery or bloody diarrhea, fever, chills, alleged lymph node, rash, itching, joint pain, or general fever. Warming or sore in the mouth or lips. They are red or purple, purpura on the skin. Skin rash, brushing pain, numbness, muscle pain, weakness. The side effects of metronidazole are nausea, vomiting, no appetite, bitter savila, abdominal pain, stomach discomfort, headache, dizziness, staggering, have a cough, sneezing or running nose, dry mouth, swollen tongue, sore tongue, dark urine. Drug allergy symptoms of two types are similar: rash, hives, difficulty breathing, swelling in the face, lips, tongue, or throat.
I will remember it.
And the last thing I have to introduce to you is how to take care of yourself for those who are urinating, and method of observing complications from urinary catheterization. 1. The area of external genital organ should be cleaned at least 2 times a day, morning and evening, and after every defecation. 2. Observe color of urine, that is turbid sediment or not. If the urine begins to have turbid sediment, sneezing or rolling the urinary catheter for better urine flow, no clogging. 3. To take care of the urine bag, the bag should always be placed below the bladder level or lower than patient. If it's necessary to lift the bag high when moving, break the urinary catheter in order to prevent urination in the bag. Reflux reach the patient, which can cause infection. 4. If urine contains more sediment together with fever, chills, back pain, or lumbar pain, indicate that urinary tract infection may occur. Or if the urine has a strange odor, such as a red blood light or foul-smelling part, notify the doctor or nurse. Do you have any questions?
No more questions? You gave me very good advice. I will follow the instruction very well. Thank you very much.
I'm willing to do it. It is my duty.
Okay.
Good morning. What's your name?
My name is Your Parkin.
How are you pain now?
I am feeling better than before because the nurse take the medicine for pain relief for me when
That's very great. If you feel pain again, notify the nurse in order to get the pain relief medicine. Tomorrow the doctor allowed you to go home. I will dressing wound for you now and demonstrate the step for wound dressing for your relative, because you should allow your relative to help dressing wound for you when you go back home. Where is your relative? Here I am. Are you a student nurse?
Yes, I am.
Do you want to know how to dressing this wound?
Yes.
Wow, you are a good student. Okay, let's start. I will dressing wound for her now and demonstrate the step for wound dressing for you, because you should to help to dressing wound for her when she go back home. May I hold the curtains and fan while I dressing your wound? Okay, the first step, wash your hand. The second step, apply the wound dressing device. Set dressing, press rope, cotton ball, bowl shape kidney, normal saline solution, gauze, and transfer. The third step, open set dressing. Pour the normal saline solution into set dressing. The fourth step, wear the first pass rope. Open the wound with a technique. Then discard in a kidney shape bowl and take off the first pass rope. Wash hand by alcohol gel. Your wound is red. It's really good. The fifth step, wear the second pass rope. Start dressing the wound. The sixth step, use your right hand to drain a tooth forceps and use the left hand to hold a non-tooth forceps. Use a non-tooth forceps to pick up a cotton ball, implant normal saline and twist. Then use a tooth forceps to pick up a cotton ball, the center of the wound, and around the wound until clean. The seventh step, finally, close the wound by dry gauze and use transfer to fix it transferably. Finish. I advise the relative dressing her wound once a day.
Yes, I understand. Thank you.
You're welcome. Try to avoid touching the wound and should not let the wound touch the water. And if the wound is dripping, notify the nurse.
Well, I will try to do as your suggestion.
Very good. I have to go.
Thank you, nurse.
You're welcome.